Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Sajid Majid, consultant child specialist. Today I will discuss an important short case of Cushing syndrome. Your command will be do general physical examination and relevant. First of all, introduce yourself, then take informed consent. Exposure should be adequate. Patient should be in panties. First inspect from foot end and then from side end. Observe for respiratory rate, periorbital edema, central or peripheral obesity, obvious moon face, and flushed cheeks. Start with anthropometric measures. Take height and weight of the patient. In obesity, height and weight would be normal. In Cushing syndrome, height will be decreased and weight will be increased. Check hands for pallor, nail for clubbing, check pulse. Say patient to raised hand above head for few seconds to check for proxial myopathy. Check BCG scar. BP will be raised in case of Cushing syndrome and atypical nephrotic syndrome. Then start from face. Moon shaped face, prominent cheeks, and excessive hair growth can be observed. Check distribution of fat central in the case of Cushing syndrome and peripheral in the case of nephrotic syndrome. Check abdomen for stria and scratch marks. Subsequently, check genitalia for trainer staging. Check lower limb, particularly check for the bruises over the lower limb. Pedal edema positive in case of nephrotic syndrome while not in the case of Cushing syndrome. In the back, look for buffalo hump, non-pitting edema in Cushing, vice versa in nephrotic syndrome. Look for excessive hair growth, stria and scratch marks. Say patient to squat and get up for distal myopathy. Check gait, cover the patient and say thanks to the patient. A 7-year-old vitally stable cooperative child during my examination having height of 107 cm with weight of 27 kg seemed to be short stature, but I would like to plot on centile charts. There is obvious moon-like face without periorbital edema, having facial plethora with flushed cheeks. Excessive hair growth was observed. Skin fold over abdominal wall was observed along with stria and scratch marks. Excessive hair growth was also observed over back along with the buffalo hump. Patient having normal blood pressure, no scrotal or pedal edema was observed, and rest of the examination is normal in the form of proximal or distal myopathy, gaze disturbance, abdominal and cardiovascular system. On the basis of my examination, my differential are Cushing syndrome, obesity, iatrogenic nephrotic syndrome. Sir, I will do 24-hour urinary collection for analysis of free urinary cortisol level. I will also perform early morning blood cortisol level. Sir, I will also do the dexamethasone suppression test, lipid profile and BSR for the obesity, and will do the urinary serum albumin and protein creatinine ratio for the nephrotic syndrome. Later on, I will do the ultrasound abdomen for fatty liver, kidney status and adrenal status. I will also go for MRI brain if needed.